stretch to the skin, tack that down, and then I'm going to take my 2 fingers and just small movements back and forth, perpendicular to the patellar tendon. You go down the length of it, come back up the length of it. How does that feel? Okay, is it like a decent amount of pressure, or does it feel soft?
It feels fine.
Okay, so how does that compare to like this?
Not enough pressure.
Yeah, not enough pressure at all. So this is where you guys as patients, being student patients, it's going to be up to you to give whoever is working with you, your partner, make sure you're giving them feedback. Tell them, I think it should be firmer. I think it should be softer. I don't think you're in the right area. That doesn't feel right. Okay, so this is now one of those things where you're going to need to practice with each other, because your spouses, kids, parents, whatever, they're not going to be able to give you that feedback. Okay? And again, I would do that for 8 to 10 minutes, is what they're saying. I have one right on top of the other, so I'm pushing and putting pressure down on this one, and then just going back and forth. So for him, he has patellar tendonitis. So what we're doing, so this goes back to our whole, like, very beginning of modalities when we talked about ice and what happens initially with an injury. What's happening? What's the first thing that happens that we want to happen?
Inflammation.
Is inflammation, right? So what you're doing with cross friction is you're causing a micro trauma to that area. And by doing that, you're re-stimulating the inflammatory process that's necessary for proper healing. Okay?
So, question.
Yes.
Would it also help if you further flex the knee to increase like tension onto the ligament?
Possibly. I feel like I get a pretty good purchase doing it this way, but you mean like this? Yeah. That probably is less work for me, actually, bringing him up. So then as long as he's comfortable to stay in that position, I would probably have to change, and I could use other hand too. So I wouldn't just be having to use the right hand.
At any time you're able to switch hands.
Mm-hmm. Yeah.
It doesn't like, you don't have to like, I mean obviously you can do for the 8 to 10, but you don't have to be consistently always on the
No.
screen.
No, you can stop and do this too. And then the other thing too, so compare, when you guys practice this, compare the patellar tendon versus if we were doing like quad tendon. If he had quad tendonitis, again, this would probably be more optimal than if he was down here, because now he's got more slack on the skin. Yes.
So, how like many treatments typically for something like that in order to reach that like restarting of that inflammation process?
Well, it's doing it right then and there.
Sure, it is.
I'm causing a micro trauma right then and there.
Oh, okay.
Yeah. Yes.
So why do you go north, south? Why do you go west, east? We start with instead you go north and south.
Because his tendon is running like this, and you want to go perpendicular.
What about if you go that way, north and south?
You go down.
Then you're not doing cross friction, and you're not really giving trauma to the area. Yeah. Okay. So that's a common one. Quad tendon would be a common one. So if we did his Achilles tendon, do you mind laying on your stomach, right? So if we did his Achilles tendon, I would have him probably with his foot off the table. Shoes and socks are off, but remember now to get a little stretch on it, I might dorsiflex him. So I would either use my leg and then be here. But again, I feel like I kind of need this hand to keep it stable, as opposed to if I'm doing this, I'm sort of just internally and externally rotating his leg. This way I feel like I can keep it more stable. Sometimes I get a little heavy with my grip, so just ask them if it's okay how you're holding them. But I would kind of cup the calcaneus and hold it there.
If the person has a greater area, are you able to use like 3 fingers?
Yeah.
To cover more.
Yeah, we could use it too. I feel like I get more local like pressure and like attack the area more by having a smaller surface.
So, what should they be feeling after that, since we're stimulating that inflammation?
So after that, he may be sore. You can expect the area to be red as soon as you're done. It might be a little bit sore, but again, it might also kind of numb it out a little bit.